Hi, my name is Kristen. I'll be your nurse today. I'm going to provide privacy and wash my hands. First, can you please state your name and date of birth?
Taylor Hart, 9/26/99.
And I'll be comparing this to her wristband. Do you know why you're here today?
No.
Today we're going to be doing a head to toe assessment. So we're going to start at the top with your hair, your eyes, ears, nose, mouth. And I'm going to kind of work my way down, listening to your stomach, your back, because I'm going to listen to your lungs and listening to your heart. And ending at your feet, I'll be just checking for edema and such. Okay? Can you please tell me, are you in a comfortable position? Perfect, then we'll start. So I'll start by checking the patient. Can you please state where you are today?
Your apartment.
And the date?
Tuesday the 12th.
Perfect. At this time, I'm checking her level of consciousness. She is alert and oriented, and her speech is clear with appropriate answers. I will then go on to check her posture. She is sitting erect. There's no visible soil, dirt or anything on her, and there's no foul odor, therefore saying she has good hygiene. I will then start with the top, the nose, ears, eyes, and throat. So I'm starting with her hair, checking to see if there's any lesions, bumps, parasites. Hair is even, thin but full. And then I'm going to work my way down, looking at symmetry. Can you please clench your jaw? Perfect. Now I'm going to be testing her cranial nerve 5, the trigeminal nerve. Can you feel this?
Yes.
Can you feel this?
Yes.
Okay. Now I'm going to test your cranial nerve 7. Can you please smile? Frown. Puff your cheeks. Good. Next I'm moving to the trigeminal nerve 3, which is the ocular motor. So we're going to be checking for Perla. I'm going to have you look at my nose. Perfect. I'm going to have you look at this. Follow it. Good. Pupils are equal, round, reactive to light, and accommodating. Next I'm going to be going to cranial nerve 4, which is the trochlear, and I'll be going to cranial nerve 6, which is abducens. At this point, I'm going to have you please look at my pen and follow the 6 points. Good. And lastly, we're going to then end with a confrontation test, which is checking cranial nerve 2, which is the optic nerve. So I'm going to have you cover the same eye as me. Okay? Put your arm out. I want you to wiggle your fingers. Let me know when you can see them.
No.
Good. And we're going to do the same on the other side. You're going to wiggle your fingers.
No.
All right. Now I'm going to be checking her nose. When I look at her nose, it is symmetrical. When I look up, it is her middle part is midline. I'm looking in the nose. No discharge present. Mucous membranes are pink and moist. Next, we're going to be checking your mouth. So I'm going to start with cranial nerve 9, which is the glossopharyngeal. Have her open her mouth. And while I'm doing this, I'm looking to see that the mucous membranes are again pink and moist. I'm going to put this on your tongue and press down. Can you say ah? This patient does not have tonsils but still has movement midline to her vulva. Next, I'm going to have her open her mouth. This is checking the cranial nerve 10. I'm touching the back of her throat to see if she has a gag reflex. This patient does not have a gag reflex. Lastly, I'm going to be checking the cranial nerve 12. And this is the hypoglossal. I want you to stick your tongue out and move it side to side, please. Good. Everything is symmetrical and even. There is no lesions, bumps present on her tongue or in her mouth. So now I'm going to be starting on the cranial nerve 8, which is the acoustic. This is going to be your whisper test. I'm also going to be testing you on balance. So I'm going to say 3 words. Whisper over here. I would like you to repeat them for me, please. Apple, dog, car.
Apple, dog, car.
Correct? And on this side.
Cat, bird, shoe.
So she can hear. Hearing is intact. I'd like you to please stand up. Okay, and I want you to stand on 1 foot, please. And stand on the other foot. Good. You can take a seat. Balance is good. And lastly, I'm going to check cranial nerve 11. This is going to be the accessory cranial nerve. Can you please look to the left and look to the right? And then I would like you to push against your knee. Okay. Strength is equal, bilateral on shoulders, able to move her head left and right. At this time, you're also checking the range of motion of the neck, which is good. Okay, so now I'm going to start working on your lungs and your thorax. So at this point in time, I'll have the patient take a breath, checking for expansion, no use of the accessory muscles. And then I'm going to check her rate, rhythm, and the depth of her breathing. So while she is breathing, I'm going to check that for 30 seconds. Rate is 16. It is normal depth, not shallow, not too deep. Rhythm is consistent. I'm now going to have you stand. Okay, and if you could actually face away from the camera and have you bend over and kind of just hang your arms. At this point, we're looking for scoliosis, which would be the S curve, kyphosis, which would be a humpback, or lordosis, which she would have concave in the back. This patient has a straight spine. Very good. You can take a seat again. Next, we are also going to look for or be feeling for fremitus, or tactile fremitus, and we are going to I'm going to have you say 99. I'm feeling for vibrations.
99, 99, 99, 99.
Okay, and they are felt. I did forget to do your lymph nodes, so I'll do those quick as well. So here I am checking for preocular, postocular, occipital, tonsillar, submandibular, submantle, anterior cervical, posterior cervical, and supraclavicle. Now I'm going to listen to your heart sounds, or your lung sounds. And at this time we're doing 6 in the front, 6 in the back, and 2 on the side. So. All right, I'm going to have you take a deep breath with me. Oh, actually I'm going to have you turn. I don't know if you can stand up for me, please. I'll just have you stand here facing the wall. So I'm going to start by taking them in the back. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, now can I have you face the camera? Okay, we're looking here. Okay. And now I'm going to have you lift your arms, please. And this time we're looking on the sides. Okay. And on this side. And again. Very good. You can take a seat. Lung sounds are clear, bilateral, no crackles sound, or abnormal breathing. I'm now going to be checking the heart. So at this point in time, I'm going to start with your carotid artery, palpating one at a time. And this one. Okay. The carotid artery is equal bilaterally, and now I'm going to listen to it, in which I'm assessing for Brute. Go ahead and just breathe normal. Take a deep breath in and hold your breath. And again. There is no Brute present, which would be swishing or whooshing sounds. Now I'm going to identify pulses. We have the temporal pulse, carotid pulse. We have the brachial pulse, radial pulse, brachial pulse, radial pulse, femoral, popliteal. All right, can I have you lift your foot? Just so we can see it. There we go. Dorsal pedialis and posterior tibial. Good. Okay, and now I'm going to listen to her heart sounds. This time I'm starting on the patient's on the right side. Okay, so listening here. This is your pulmonic. Or aortic, excuse me. This is the aortic. Pulmonic. Okay, I'm just going to kind of go down. Erb's point. I think I did those backwards. I'm going to fix it anyway. So, aortic, starting there. Pulmonic. Erb's point. Can you please lift your breast for me? And now checking tricuspid. And mitral. This is also the apical pulse. Listening to this for 1 minute. Rate and rhythm is regular. I'm going to have you stand and face the camera. So again, this is aortic, pulmonic, Erb's point, tricuspid, and mitral. See? All right. Now I am going to move on to, make sure I have everything. Now I'm going to move on to the GIGU. So at this point in time, I'm going to ask you to please lay on the ground. And my assistant here is going to videotape. Okay, so at this point in time, I am now going to check the GIGU. I begin by listening to the lower right quadrant because this is where the most sound is going to be. I am then going to work in a counterclockwise motion and listen to each section for 1 minute. Yeah, can you roll your pants down a bit? Thanks. vowel sounds are equal and active in all 4 quadrants. You listen first before touching because otherwise it can alter the sounds. So at this point in time, I'm going to just feel. Is there any pain when I'm feeling around? Yeah. So as indicative, there is no bone tenderness. The stomach is flat, non-distended. And again, bowel movements are equal in all 4 quadrants. Now what I'm going to do is I'm going to be checking her skin. I'm checking for temp, edema, and now I'm going to do cap refills. Nails need to be clean, no nail polish, and less than 1 second. Less than 1 second. Okay. I'm now checking again. Temp. Skin is warm, moist. Looking for edema. Nails would need to be clean. And then I would be doing a cap refill. At this point, while I'm down here, I will then check pulses to make sure that they are equal. Behind the knees. All right. And now I will have you stand. Okay. And while you're standing, I will have the patient if you could please go back to the cat tower, okay, and walk towards me. Yeah. This is checking balance. So, my iPad was full, so it cut off in the last video. I'm going to pick up where I left off. I'm going to have the patient walk heel to toe. This is checking her balance, okay? And have you turn around and walk normally back. All right, and you can come. And now stand in front of me and I want you to shut your eyes. I'm going to press on your chest and I basically want to check your balance. Good. Okay, you can open your eyes. Stand on one foot, please. And on the other. Good. So her balance is intact, which would mean that her equilibrium is intact. In addition, there is no signs of limping. She does walk straight with toes pointed forward. And you can take a seat. All right, lastly, what we're gonna be doing now is I'm going to be checking the reflexes. So I already did her extremities as far as the warmth. So now we'll check those. So I'm gonna start by having you relax your brachial, okay? So this is the bicep reflex. And basically I'm gonna hit it. Come on. It's supposed to be. There is no movement. Come on. That's not working. Okay, so that would be that. Next, I'm gonna have you kind of hang your arm like this for me. Okay, this is the triceps, and basically we're looking for movement. Come on. There, we got a little bit. Okay. All right. And then I'm going to have you like this. And this is the brachioradialis. At this point, we're looking for movement of the thumb.
Ooh,
good.
I saw it.
Then now I'm going to be checking her patellar, which is the knee. Again, we are looking for movement of the knee. So there we go. Perfect. I am now going to check the Achilles.
Ooh, I saw it.
And now lastly, we're going to check the foot, the plantar. Now I'm going to lift this and we're checking for the Babinski reflex. All right, so we checked cap refill gait, balance, ROM. So now we'll be checking the range of motion. Basically what I'm gonna have you do is I want you to lift up and down, and we'll make a circle. And this is just guided passive range of motion. Now if you can please arm up and down, good. Wrist, I want you to go like this, and like this, and move it around. Can you do the same thing with the other side? So up, down, and around. Okay, and up, and down, down, up, and around. And while I have our hands up, I like to put your hands on me, okay, and push against me. Strength is equal and bilateral. Now we're gonna have you lift your foot and down. Ankle up, down, and around. Do the same thing with the other side, please. Down, ankle up, down, and around. Again, I'm gonna have you push against my hands. Good. Strength is equal bilateral. And I think that concludes. Here are your fingers. Move your fingers. That would conclude my head to toe. At this point in time, I would make sure that I wash my hands. Provide and ask the patient, are you in a comfortable position? Yes. Provide a call light. If you need anything, feel free to give me a call. That's it.